Today I'd like to talk to you about a condition called Dupuytren's disease, and it's a condition where the fibrous tissue in your palm becomes abnormal, and it can cause firm tissue, and it can cause your fingers to curl up to a degree. And in your hand, your skin of your hand is different from the skin in other places, and you can notice that yourself. If you move the skin in your palm, it doesn't really move. If you move the skin in other places, it does. And of course, that serves a purpose. When you grab things, you want to be able to hold on to it. You don't want those things to be moving around. Now, the reason that the skin in your palm is different is because you've got fibrous tissue underneath the skin of your palm, and it goes down to your bone, it goes up to your skin, and effectively anchors the skin of your palm onto the bones. Now, Dupuytren's disease, which is a genetic condition which about 1 in 20 white-coloured people have, those fibrous tissues become thickened and they can tighten up. And you can realise that for a number of reasons. Some people find that they've got little nodules or little pits, firm areas in their skin. Sometimes you find that you get what almost looks like a tendon underneath the skin. It's not a tendon, it's kind of a thick band of fibrous tissue. You find that develops over time in your palm. And for a portion of people, they'll find that their fingers curl up. And it may be that they curl up a very small amount, or it may be that actually they curl up very much. It depends on the genetics of it. There's some families who've got a very strong genetic predisposition and they curl up a lot, like the person in this picture here, who has got a very curled up finger. And some people hardly notice that they've got any finger curling at all. So it does vary between people. Now, there are a number of different things that can be done about this condition. I mean, it's not possible to cure it because it's a genetic condition, but it's certainly possible to influence what's happening in your palm. Now, for some people, they need no treatment whatsoever. And a good way of judging that for yourself is if you put your hand flat on the table and you find that your palm is able to touch the table, most of the time it's not worth your while having treatment. But if you find that when you put your hand flat on the table that your palm doesn't actually touch the table because your fingers are bent up to a degree, then it's worth discussing whether there's a treatment option for you. And treatment options roughly go into 3 different ways. So we can do an operation called a fasciotomy operation, where we make a wound in your palm and simply remove the fibrous tissue that's causing the contracture. And that, generally speaking, does well. Most people end up with a good result following that, but it's an operation and it does take a while to recover. And again, going back to the cause of the condition, we're not getting rid of the genetics, and therefore it's always possible for it to come back. Although majority of people who have an operation don't require an operation again for that area of their hand. And if you have a fasciectomy operation, it does involve usually wearing a splint at night after the operation for a number of weeks, or quite often a small number of months. And it does involve doing quite a lot of exercises to get both your fingers straightening maximally and bending maximally with the hand therapist after your operation. Generally, it takes about 2 weeks before you're using your hand fairly well, and it takes quite a lot more weeks before it's feeling really back to normal. So that's a fasciectomy operation. That's the biggest of the 3 options from a treatment point of view. Another way of treating it, and it's particularly for people who've got a bend of this joint here called the metacarpophalangeal joint, and a palpable, what we call cord, it almost looks like a tendon, although it's a fibrous tissue under your skin. And there's an operation called a fasciotomy operation, which we do through some incredibly small holes in your palm. And if you've ever had a blood test taken, if the needle, obviously, that punctures your skin, it's got to be sharp. If you were to look very carefully at the end of the needle, it's almost like a tiny little knife. And so what we can do, using a needle and local anesthetic, is simply divide that cord of tissue that's causing contracture, divide it in a number of places so we don't remove any tissue. Then you find your finger usually tends to straighten out. And of course, because we're using a needle, the holes that we do it through are incredibly small and normally heal up very quickly, usually within 2 or at most 3 days for most people. And therefore, your recovery is very quick. Most people normally only need to take the day of their operation off work, or occasionally the day after. It's very rare to need to take more than that, and your recovery is very quick. Like the fasciectomy operation, there is, of course, a risk of it coming back, as there are for all these treatments. And then the final option, which is a bit between the two other options in terms of the size of the treatment, is there is an injection we can do called collagenase, or the trade name for the medication that we inject is called Xiaflex. And what that injection does is dissolve the fibrous tissue that's causing the contracture. And what we do is we do the injection. Then you tend to find over a couple of days your hand does become relatively bruised and swollen. Then a few days later we put some local anesthetic into your palm and then manipulate your finger, and most of the time it'll come out straight. Although it does take a few weeks, usually about 4 weeks, before all the bruising and swelling goes away, and it takes somewhat longer to recover and return to work compared to the fasciotomy operation, but only modestly so. And that's good for lots of different Dupuytren's conditions, particularly for the metacarpophalangeal or proximal-to-phalangeal joint contractures. So it can deal with some contractures or some bending of your finger that's a bit more severe than we can manage for the needling operation, but it's much quicker to recover from compared to having the open operation. One problem with the collagenase, the Xiaflex injection, is the actual medication that we inject is relatively expensive. It's usually about $1,350 when you get it from the pharmacy, and most of the time your health fund won't cover that, and so the cost is borne by yourself. So summing that up, it's a genetic condition. We can't cure it, but we can certainly influence what happens in your palm. If you can put your hand flat on the table, it's usually not worthwhile having treatment, but of course we can discuss that. Once you can no longer put your hand flat on the table, those three treatment options, so the operation, the needling operation, or the collagenase injection, all are very useful, and for different people, different ones have their different merits. So I look forward to talking to you about your Dupuytren's contracture, and we look forward to seeing you in the clinic soon.